Hi everybody, welcome back. This is the second video mini lesson located under the Influences in Public Health for Community Health course, and we are going to be focusing on epidemiology. So first of all, you need to know what epidemiology actually is. The job of epidemiology is to determine factors that are responsible for significant health changes in different populations. Remember, another term for populations is aggregates, so in different aggregates. It is the fundamental science of community health. The overall goals are to prevent or control disease and promote health. Epidemiology is going to study many different aspects of health disease and health promotion. These include things like studying chronic diseases, infectious diseases that might be uncontrolled. It even looks at mental health, substance abuse disorders, or any type of acute or emergency conditions. There are several definitions and terms that you need to know for epidemiology. First off, you need to be aware of what the word endemic means. Endemic, it's a disease that exists permanently in a particular region or population. For example, malaria is a constant worry in parts of Africa, so it's endemic to that area of the world. Then you've got epidemic. This is the term that people think of a lot when they think of epidemiology because it's in the name of epidemiology. Basically, what an epidemic is it's an outbreak of a disease that attacks many people at about the same time, and it can spread through one or several different communities that are close together. Now, a pandemic builds on top of what an epidemic is. A pandemic occurs when you have an epidemic that spreads throughout the world. So it's something that is not controlled and is able to spread from one community to another community in a completely different part of the world. Other basic concepts to be aware of with epidemiology. We do study morbidity and mortality. Morbidity, it concerns the levels of disease within a population itself. Another term that you might hear people talk about is prevalence. So if they talk about prevalence rates of a certain disease, they're really looking at morbidity. So in a population, what are the levels of the disease? You might also hear the term incidence rates. Incidence rates are a little bit different than your morbidity or prevalence rates. With incidence rates, you're looking at the probability of getting the disease in a given period of time. So it's not a measurement of the actual disease found within a community. They're looking at what is your probability of getting the disease or getting this particular disease within this type of community. And finally, you need to be aware of what mortality means. When they're looking at mortality rates, they're looking at the ratio of the numbers of deaths in a various category to the number of people that are already in a given population. So mortality is looking at how many people have passed away within this particular community, this particular population, or aggregate, or category, and they compare it to the amount of people in a given community, or population, or aggregate. With epidemiology, you also have this triangle. This epidemiological triangle is used to understand the complexity of how diseases are spread throughout a community. And there's three main components to the triangle. You see up here at the top, you have a host. The idea behind a host, which can be a particular aggregate based off of age, sex, race, genetic profile, all of those listed above, these are the people who are able to get infected based off population. Then you look down here into this green section where it says agent. An agent is an element that must be present or it can be lacking to have the disease spread. So it could be a biologic agent, a chemical, a physical, or nutritional, like a lack of nutrition, a lack of, the ability to get appropriate nutrition in the population that you live in. So it can be present or lacking, and it allows the disease itself to spread. And finally, the portion of the epidemiological triangle is environment. When they look at environment, they're looking at how people in different populations and aggregates live and how this allows the disease itself to spread throughout that particular population or community. So you're looking at the temperatures found within the environment, humidity. You can look at crowding and housing and how, let's say, tuberculosis can be spread and crowded living conditions. The access to water, the access to milk and certain foods and nutrition. All of these can play together with environment, agent, and host to describe how these diseases are spread throughout a population, an aggregate, or a community. So thinking about epidemiology, I also want you to be aware of healthy people. Now, up here on this slide, it says Healthy People 2020 because we are still, for the year 2019, focusing on Healthy People 2020. Next year, we will begin focusing on Healthy People 2030. When you think about Healthy People 2030, it is developed by the U.S. Department of Health and Human Services. It's a program that is overseen by the Office of Disease Prevention and Health Promotion. It essentially is a document and a program that aims to promote health and prevent diseases. We try to increase the quality of healthy living, increase the years of healthy living, and eliminate any health disparities. And health disparities are just unequal access to health care or the ability to have a healthy lifestyle. When you go look at the website, which I've provided a link to the Healthy People website, and it focuses on the framework for Healthy People 2030, you'll see things such as overarching goals and plan of actions. Examples of an overarching goal, so a very broad goal that they've described or attested to themselves, is to attain healthy, thriving lives and well-being, free of preventable disease, disability, injury, and premature death. That's one of the several goals that they have, but they're very nice and broad and give you an idea of what the aim is of Healthy People. Then plan of action are much more concise and measurable ways that Healthy People plan to meet their overarching goal. For example, one of the plan of actions listed is to provide tools for the public, programs, policymakers, and others to evaluate progress toward improving health and well-being. So you can see through this document and the link provided on Canvas just how much Healthy People programs affect how we provide care to the American population. They change Healthy People, or they update Healthy People every 10 years. So we're going to start seeing Healthy People 2030, and by the time we finish the 2020s, we're going to start looking at Healthy People 2040. Let's do our NCLEX knowledge check for this unit. So take a few minutes to read the question and provide an answer. Did you get it right? Diseases that have an endemic pattern may or may not be contagious, but they are always present in the community. For example, that we gave in Africa with malaria. So endemic is always found in that particular area